We're here at Fresno Surgical Hospital with our special guest, Dr. Michelle Schultz and Mr. Jeff Brown. Thanks for joining us today. And we're talking total joint replacement. Okay, now Dr. Schultz, a lot of people wonder, they have some joint pain and they're not quite sure, should I have surgery, should I not? How do they know?
Well, I think the first thing is they've got to be diagnosed with that joint, worn out joint. That's step number one. Step number two is what are their symptoms? How much pain are they having? Joint replacements really are to help function, to help with pain and to cure that. So if it's just clicky and noisy, that's not necessarily probably enough to want surgery. Patients usually know when it's time. I tell them, your joint's worn out, you'll know when it's time. When it hurts enough and the non-surgical stuff isn't taking care of the pain, that's when it's time to have surgery.
Right on. So you know that you know that you know, and I see Jeff nodding his head that he knew when it was time, and we'll get to your experience in just a second. But Michelle, some things that maybe dissuade people from getting this surgery is the recovery time, but we're finding out maybe it's not that bad. Can you share with us a little bit about the recovery time?
The recovery times, it's variable person to person. I tell people 3 months really to recover from this surgery, but usually by 6 weeks, people are getting around pretty well. It's the first 2 weeks, pretty tough as far as the recovery goes. It requires a lot of rehabilitation. It hurts, but the good news is it's hurt that gets better versus what they have, which is an arthritic joint that's going to get worse and worse over time.
So we have one of your patients here, Mr. Jeff Brown, and you guys were high-fiving, high-tenning earlier. Jeff, so thankful for what you provided, that's for sure. Now, Michelle, I don't know if you know this, but this is just a rumor, but apparently it was down to Jeff and Mark Wahlberg as to who was going to star in the leading role of $6 Billion Man. And they picked Mark Wahlberg for some reason,
Go figure.
Probably political, okay? And yours was much less than $6 billion, but you're worth every penny, that's for sure. All right, so Jeff, why did you seek this treatment?
Well, I used to be a really active guy, and I just got to the point where I was running marathons and half marathons, golfing, coaching full-time, teaching full-time, on my feet a lot, and it just got to the point where I couldn't do what I normally wanted to do, and where I reached a tipping point when I was on a vacation in Oregon and couldn't walk on the beach with my wife without a considerable pain. So and Dr. Schultz always said, you'll know when it's time. That's when it was time.
So you wanted to get back in the game, all right, and you got back into the game courtesy of Dr. Schultz, and you guys have something in common because you both like to run, and marathoner, half marathoner, you guys run miles and miles and miles. You've had your surgery. How are things going so far?
Well, I don't run anymore, marathons, but I do a lot of biking, and this summer I went up Mount Hoffman, which is in the middle of Yosemite at about 11,000 feet, and then in August we climbed Half Dome, which is a very rigorous climb, and there's absolutely no way that I could have done those things without having the knee replacement. It just wouldn't have happened.
That's fantastic. I'm sure that warms your heart, Michelle, as you hear that. What's next? McKinley, Everest, perhaps? Sky's the limit, right, Jeff?
Maybe Mount Whitney, but we'll see.
Oh, right on. Okay, Whitney. There we go.
Whitney's closer to home. So.
All right. And speaking of Fresno Surgical Hospital, you had your surgery performed right here. I understand it was a great experience. Can you share with our viewers what you experienced?
It was a fantastic experience. The staff here is just incredible. Very, very friendly and courteous to both me and my family. It was like being in a hotel. The food was great. The food options that they provide. It was like being in a hotel.
Dr. Schultz, Jeff's story, is it something that you find that's pretty consistent? And if so, is that why you choose Fresno Surgical Hospital as your place to perform these surgeries?
I'm not surprised with Jeff's experience because I hear that from lots of patients. They have great experiences here, especially in the inpatient setting as well. I trust the nurses. I know that they're going to take good care of my patients. The staff is great here. So it's a great place to operate, and I'm always grateful for all the help here.
Wonderful. Jeff, would you recommend Fresno Surgical Hospital to family and friends?
Absolutely. And my wife has had surgery here, my son and me, and It's just, if you're going to have surgery, this is the place to do it.
Right on. Well, we thank you for your time, Dr. Michelle Schultz. We appreciate the difference that you're making. $6 billion man, Jeff Brown, we appreciate you being here. And thank you, viewers, for watching. And we'll be back with more